Hi, my name is Tristan, and I'm an RN student at Iowa Western Community College. Today I'm going to be doing a PowerPoint presentation on Fragile X syndrome, better known as FXS. What is Fragile X syndrome? It is an inherited genetic disease that causes intellectual and developmental disabilities. This affects both males and females, but females usually have milder symptoms. It affects more men than it does women. They can experience a range of developmental and learning problems. This is a lifelong condition. Some people are able to live independently, but they still need structure and support. There are fewer than 200,000 cases in the U.S. per year. It is caused by the expansion or lengthening of the FMR1 gene on the X chromosome, known as a gene mutation. The X chromosome is one of two sex-determining chromosomes. When the gene lengthens, it switches off production of a protein that is involved in brain development and other functions. Females have two X chromosomes, males having one X and one Y. Normally, the X chromosome contains 6 to 50 repeats on a gene. The FMR1, better known as the Fragile X mental retardation 1 gene, is responsible for producing a protein that is vital for normal brain development. FMRP is known as the Fragile X mental retardation protein. This is the protein that is vital for the normal brain development. In some people, this gene may contain between 50 to 200 repeats. This is called Fragile X permutation. Signs and symptoms will vary in severity. They put it into 5 categories that show altered or arrested development: intelligence and learning, physical, social and emotional, speech and language, and sensory. On this picture, you notice some of the characteristics on an infant: flattened nose and face, upward slanting eyes, the single palmar crease with a short 5th finger that curves inward, and widely separated first and second toes and increased skin creases. The diagnosis and treatment. There is an FMR1 DNA blood test that you can have done. It looks for changes in the FMR1 gene that are associated with Fragile X syndrome. There currently is no cure. Treatment is aimed at helping the patient learn key skills, such as language use and proper social interaction. Medications that are typically prescribed for behavior disorders, like ADD, or for anxiety, may be used to treat the symptoms. It is a lifelong condition and can affect all aspects of life, including schooling, work, and social. So here's a question. What are some signs and symptoms that you might see on an infant with Fragile X syndrome? A. Short stature, heart defects, and certain learning disabilities. B. Flattened nose and face, widely separated first and second toes, and irritability. C. Tachycardia, abdominal pain, and ceraturia. Or D. The webbed neck, puffy hands and feet. The answer is B. Flattened nose and face, widely separated first and second toes, and irritability, also known as anxiety. Second question. What is the treatment for Fragile X syndrome, and at what age can treatment start? A. None. Treatment is aimed at treating the symptoms. B. Maintain a gluten-free diet. C. Human growth hormone and estrogen replacement therapy. Or D. None. The infant will grow out of this disorder. Answer A. There is no treatment. Treatment is aimed at treating the symptoms, such as medications to treat anxiety or hyperactive disorders. Thank you for checking out my PowerPoint. I hope you found this information helpful.